Hi, welcome to Dr. Paul's show. I have the pleasure of introducing Bridget, who's been a patient of mine for almost a couple decades now, and I asked her to come in to tell her story. She got a great story to tell, and just like everyone I see here on the show, everyone has a unique story to tell. So I'm going to turn it over to you, Bridget.
All right. So we start when I started seeing you.
Mm-hmm.
All right.
And even before that, just go back to before, like in your life when you first started to feel like something wasn't right in mood-wise, or go back and then kind of walk us through that.
Okay. Actually, the first time I started feeling depressed, serious depression, was when I was about 15 or 16, and I went on a birth control pill that was way too strong for me, and I think it was that. I'm not quite sure. It was a long time ago, and it was kind of scary. So I switched and got that all taken care of. And it was level depression. It was depression, and then it would be okay for a long time.
Mm-hmm.
The second time I remember it getting really bad was before I got divorced in about 2010. And a few things happened where I could just feel everything just like drain out of me, and it would never come back. And that's, I think, when I started to see you. But I don't know. I mean, I don't even know what else would you like me to? Sorry, I've done this before.
Just what that felt like. So describe when you felt depressed. What were you feeling, and what were the symptoms you were getting?
It was just, I remember standing in a restaurant, and my ex did something, and it just, everything, like my whole energy, everything drained out, and I remember just feeling like nothing was in there, and then I couldn't get it back, and just empty and like heavy, and just crap, now what am I going to do? This is not going to work for me.
Mm-hmm.
And then I started seeing you, and then getting on what I started with, just boom, right away I was like back to normal. But it took me a long time to figure out, what to do. And it was pretty scary, because there was times I didn't know if I would just sit there and think about suicide all day. Like, I wouldn't do it. I have 2 girls, and it's not me.
Right.
But it just pops in your head, and you can't help it.
I call this passive suicidal thinking. So active thinking means I have a plan, I know I'm going to do it. Passive thinking is more like what she's talking about. I'm not going to do anything. I couldn't do that to my kids, whatever. I have a reason I'm not going to do it, but if I don't wake up tomorrow, I'm totally fine with that.
Yeah.
So that is just as bad. In my opinion, if you're thinking that and a patient tells me they have passive thinking, it can turn into active thinking over time. But that's a bad sign that we need to do something. Because again, if someone's feeling that, that's not right. If someone does not want to be here, and life is so precious, that's very significant. And anyway, and then what's also significant, starting as a teenager, is very common. These things start in the teen years due to hormonal changes, and we'll get to genetics in a moment, but. Yeah, but let's get to genetics now. Tell me about your family history.
We have a long history of depression. My uncle had schizophrenia and bipolar disorder.
Mm-hmm.
He was in the hospital a lot for it.
Like what side?
Really bad.
Mom or dad?
My mom's brother.
Uh-huh.
It was my mom's side that was really had the problems. My dad's side, there was no history of depression or anything like that. But my mom's side definitely had.
How about your mom?
My mom did, yeah. She had some depression. I think she comes and sees you once in a while. My dad comes and sees you once in a while, but he was a cop. I think that's a little bit different. His wasn't really genetic. It was more like because of just things he's seen and being a police officer and stuff like that. But yeah, my mom, it's a lot of it's more anxiety, I would think, than depression for her.
Mm-hmm.
For me, it's the depression gets pretty bad. The anxiety I can control. That's not so bad.
Do you take more after your mom or your dad, as far as looks and personality?
I'm half and half.
Right. So the reason is this important is when I hear that history. See, you're not schizophrenic or bipolar, even though your uncle was, but you have that on that side of the family. So you get a little piece of that from him. You get a piece from your mom. But dad's side, in a sense, kind of protects you because the fact that there's no history on his side that you can see. I mean, some people can see it. There is some, but you can't really see it. That's why I call it like watered down genetics. Is what I term this, where you get from both sides, but your dad's side kind of protected it from getting worse than it is already.
Okay, that makes sense.
Yeah.
My brother's really bipolar, but he won't see anybody for it.
Right, and that's more men. Men are much more difficult to treat because men, you know, they don't want to be treated. They want to be macho. They think it's a weakness, and so they're not as open as women are to understanding and learning these things. They just, no, I'm not a pill guy, whatever. I mean, and not that I don't see that from women too. I mean,
Sure.
a lot of women say the same thing, but it's more with men, definitely.
Yeah, that makes sense.
But right there, I mean, the biggest factors are genetic factors, hormonal factors. Like with women, you know, we're talking teenage, we're talking PMS, we're talking postpartum, menopause. You know, we got a lot of time. And then like someone, you know, like PTSD, like if you like policemen, people from the wars see a lot of bad stuff and get traumatized. So that's a factor that also plays into this. So these are the factors that lead to these problems happening that you have no reason there. I mean, there's nothing you can do to prevent it. What we do have is, thankfully, is treatments. And so talk to me about your experience with the treatment, or what's kind of, you know, do you remember anything about details about medications? Or
when I first started, I can't remember what we were taking exactly, but I remember I was on Wellbutrin for a long time. It worked for me for years, probably 10 years. And I think I just ended up wearing it out because I took the highest dose eventually. Prestique I love. It makes me feel just totally normal, and I don't really have side effects from that unless I don't take it. It makes me feel like I have like helium in my head. And then I just recently switched to Rexulti, which makes me feel like a totally different person. And I knew right away that something had been wrong, that I should have switched earlier. But I just kept thinking, oh, I'm all right. I'm just, you know, I didn't have it. I was unemployed for a while. It's probably just that. It's probably just menopause. It's probably this or that. It'll be all right. And then we switched recently to the Rexulti, and I was like, no, I was not all right. Now nothing bothers me. I don't even care if I don't have a job right now. I still am happy, which is really cool. And that's how it should be, because it's making my life easier.
Treating this, you know, in a sense, puts you more in control. You know, so that way when things are bad around you, like I said, finding a job, something happening negatively or whatever, getting fired, whatever, you know, the people say, you know, I can tell I'm handling it better than I used to be able to, because your chemistry is balanced know, more properly.
And I was so bad that I wasn't doing any laundry. I wasn't taking showers. I would go downstairs in the morning. I wouldn't come back up till bed. And I would just take whatever clothes were on the floor and put them back on.
How long ago was this?
This was all last year.
Wow.
And it was really rough for me after. I did get fired from a job that I really liked, and it wasn't fair, but it is what it is, and I just really had a hard time with it. And
it's hard out there finding a job, too.
It's really hard to find a job. And I would still come in with my appointments, but I would just be like, I'm fine. You can't help me if I keep saying I'm fine.
Yeah.
So that wasn't a good thing, but now, like I said, with this new stuff, I have been a whirlwind around the house. My roommate and my daughter are going, you are like night and day. I'm doing all the laundry now, everyone's, and I can function. I was having a really hard time functioning, and so I'm really glad I spoke up and was like, okay, we need to make a change.
Well, people get just kind of satisfied with well, I'm okay, you know, I'm just, you know, like, I'm okay, you know, so people understand that you can get feeling better if it just takes working on your chemistry. But and I think also we switched from Wellbutrin to Auvelity.
Auvelity for a little while, but I didn't like having to take it twice a day and setting my alarm. It just, and at the time I still was a little bit more on the depressed side. And I think setting my alarm every day, I was like, it's 1:30 again. God, the days are just flying by type of thing, you know?
So you went back to Wellbutrin?
No, I just stopped taking it, and I just been taking the Rexulti.
And the Prestige, that's it?
Yep.
Oh. You're feeling good on that combo?
Amazing.
Okay. Well, good.
So, yeah.
If things change, let me know. If you start to feel like the bottom drops out on you a bit, then we can talk about putting the Auvelity back in again. But if not, then you're good. But
I just felt like the Wellbutrin wasn't doing anything for me anymore.
Right.
And I didn't want to be that lady getting old and being like a million medications. You know, I'm trying to still
I hear
keep
you.
it normal, but
but you know, I caution people to not worry about the number of medications. I think people get a lot thrown off by like the number. Well, I don't want to be on 3, and I want to be on 4. I want to be on 3. I want to be on 3. I want to be on 2. So they play the number game. Like, I want to be on. It's not about numbers. It's about being on the right medication for you and combining those together. And so most of my patients are on 2 to 3 medications on average. Some 4 to 6, some 1, but normally it's not 1 normally, because I'm looking for complete results, and to get complete results you have to put things together.
Right.
And that's the part of this field that is really unappreciated and not really done nearly enough, in my opinion.
Yeah.
I think doctors get kind of stuck. This is like SSRI for everybody, and then it flattens people out, and they just like, well, are you feeling better? Yeah, I'm feeling a little better. Okay, well, goodbye. So a lot of that treating people just partially and not fully. And that's why that's why the Rexulti is such a great medication, because it really kind of gets you past that. Now, you never had any you ever had any like high highs where you get really like up, or no? Or
not really. I've always been pretty even.
Okay.
Yeah.
So so you don't have any history of mania.
No.
Yeah. So you're, it's just, but you're in a more, we call it more of a treatment-resistant depression. So that's why it took the time to get the combination right with you.
And like I said, it goes up and down. Like I wore out the Wellbutrin, I took it for so long. It worked great forever. And then the one thing I do miss is Xanax, but I know I took it for way too long, and that you're not supposed to take it for too long. But I do miss a little half of Xanax at night before bed. It did help me sleep and not wake up in the middle of the night. But I know that's one thing you're not supposed to be taking forever, and I really liked it.
we can talk about that.
Yeah, I mean, that would be cool. I was having trouble lately, and I know it's part to do with the menopause. We're at 2:15, bing, right awake for 2 hours, just
Really?
yeah.
Yeah, we'll talk about that.
Okay.
So, but the goal of treatment really is where you are now. And I don't like to stop until I get there. And I got a lot of people just get, they were here and we have them here, which is good, but I want to get them to here, but they're just kind of there. And a lot of people's like, I like it's better than here. I was here. I'm happy with here. Yeah, I can get you here, but no, I'm fine. So there's a lot of that. The people that never quite get there because they won't let me finish what I start.
No,
and that's and at least it's better than nothing.
Yeah, no, I know it is better than nothing. But I went from thinking I was okay to not doing anything to probably one day this week cleaning a whole fish tank, making sourdough bread from scratch, doing laundry. Crazy stuff. I did planted a whole new garden all in one day.
Wow!
And it wasn't like I was running around like crazy. I was just cruising, just getting things done, and it was all good. And I took a shower and everything.
Nice.
Unclean clothes. So
exactly.
It's a big
just
difference.
Life.
It was really hard for a long time. It is life, and it's
it's just a lot of times it's just functioning in life, and just a lot of people when they're depressed, they just, like you said before, don't want to get out of bed. I don't have nothing to look forward to today. Why not just sleep in every day? Because and then they get off track with their sleep schedule, and then. It's a lot of people develop really bad habits. Of course, when you're depressed, you don't have the motivation to do those things.
No. Luckily, I have 3 dogs that make me get out of bed.
Good.
But then I'll go downstairs and sit outside with them all day.
Yeah. But then you have to walk them. So.
Once in a while.
That's all right.
I just throw the ball a lot in the yard.
Oh, 3 dogs. Wow.
3 little ones. They're all little.
They're all little dogs.
2 are older. Yeah, they're fine. But it's just. Then I don't go back upstairs. Then I don't get the laundry done because it's all up there. And I just needed to be. I don't know. I had like a block. It was the weirdest thing. A block. I could not go back upstairs until bedtime, for no reason. It wasn't like that before.
Yeah.
And it just hit me and not doing laundry was like a block. I just couldn't do it.
Yeah.
It was so weird.
Yeah, and I think you're a perfect case of just not giving up and just keep pushing. And unfortunately, there are people out there who are watching this who, are stuck. You're stuck at this spot. Your doctor doesn't really have any other ideas, or the ideas they have aren't working, or they're not tolerated. Give me a call. I can try to help. I see a lot of people out of my area. We can do phone visits and Zoom and things like that if we want. Because again, a lot of times, like I said, with you, it took a little bit of time to figure it out. But now that we have it, it's good.
Awesome.
The only thing I can think of with you really is if you start missing the Wellbutrin or the Auvelity at some point, that might happen.
I'll just keep an eye on it.
That might happen at some point. Now that we know,
Mm-hmm.
and then if you find that all right, I'll add it back in, I'll set the alarm, and I'll just do it.
That's fine. Yeah, that's
yeah, if it's
fine.
worth it, it's worth it. If it's not, if you're feeling fine where you're at, you're good to go.
Okay. What's the difference between the Auvelity and the Rexulti?
So the Auvelity is, and I'll explain this on the board later, but Auvelity basically is Wellbutrin plus it's dextromethorphan, which is actually a cough syrup. The cough syrup, they do it in a high grade form, and they add it to like Wellbutrin, and it boosts a chemical called glutamate. So it's a totally unique antidepressant. Nothing ever been. It's the only new one for years, and it's a very unique product. And it's very good for people who are kind of stuck, and maybe the Wellbutrin's not working as well as it should. We get the Wellbutrin to the highest dose, and we still are not seeing that robust energy and motivation and mood boost that we're looking for. So in that case, I often switch to Auvelity, and boom, it's like magic.
I did feel better when I started taking it.
Yeah,
for a little while.
It's a different chemical that the others are balancing. That's a different one that you have had before, and so. But yeah, your is more of a difficult to treat. But thankfully, we got the answers, and I think it's not going to be difficult to treat anymore. Now that we found this out with Rexulti, you're good to go. I think. Very good.
Good.
So.
Yeah, I'm happy.
Anything else you'd like to add before you wrap it up?
I think we're good. I think this was awesome, and I appreciate you letting me tell my mini story at least.
Yeah. Well, I've seen you and your family for
a long time. And one of my kids comes and.
I know.
Yep. So it's good.
So anyway, well, thank you for coming in, and we appreciate it.
Thank you so much. You too.
Hi. So let's talk about Bridget for a minute. She, again, a case someone I've seen for years. She was really tough to treat, but I got to the answers fairly quickly with her. But she had a long history of depression. And remember her family history, some bipolar going on mom's side, and so that's always a hint. When antidepressants aren't working fully, often adding a mood stabilizer, which we'll talk about right now. But so in her case, she is on Prestique, and anyone who watches my show knows that it's my favorite product. Is it for everybody? No, of course not. Nothing's for everybody, but it's great. It's a great medication. So it's a serotonin and norepinephrine reuptake inhibitor. So it blocks the reuptake of serotonin and norepinephrine. And so instead of going this way, they end up going that way. That's great. Now what? So I often add Wellbutrin, which is norepinephrine and dopamine. So when you get the dopamine kick in there, see, the Prestique really is going to be better mood, lifting depression, lowering anxiety, helping with body pain, body aches and pains. Just a great medication. The downside can be it's incomplete, because if it's sometimes it's better, but then it might lower motivation, energy a bit. Some people feel a little bit apathetic, though. Prestique is typically better than SSRIs like Zoloft and Lexapro and Prozac and the others, because of the fact that they are more prone to make people feel apathetic and dull. So the SNRI class works better because it's doing more, but when you balance norepinephrine, it's better result, less side effects. But still, we need to be complete, especially someone like her that's been a difficult one over the years to figure out. So when I put Wellbutrin in, she did great. So when we put Wellbutrin, we got dopamine, and now we got, again, motivation, energy, happier, more positive. Then what's happened is she started to find the effects was wearing down. So I thought, okay, well, there's a new medication I've mentioned in other shows called Auvelity. That's Auvelity, Auvelity. It comes in one dose. But basically what they do is they use Wellbutrin, and they add an element called it's dextromethorphan, which is actually a cough syrup, and I mentioned that I know earlier, but it actually, at the end of the day, it ends up boosting the chemical glutamate, which is the fourth one here, which is GABA and glutamate. And so when you boost glutamate, now it could really help with the energy, the motivation, and now we've got basically, I call 4 out of 4 when we're working on all 4 neuroreceptors at one time. What you didn't like about it is that you had to take it twice a day, and then you have to take the second dose in the early afternoon. You have to set the alarm to remind yourself. So she didn't really like that. However, since we still weren't quite there with this combination of these two, I thought about Rexulti. Again, no, so Rexulti, they market, and if you see commercials about, ask your doctor about adding Rexulti to your antidepressant. That's their message, and what their message is, and what they say is that it's treatment for major depressive disorder, and that's wrong. They're totally wrong. They're false advertising. Rexulti is a mood stabilizer. It's an atypical antipsychotic. I use these class a lot because they're extremely useful. But as you heard when I interviewed, she didn't have any mania. She had no signs of, like, what you think about bipolar is when you get real high and then crash. A lot of people, it presents with just difficult to treat depression. Depression that's just not getting there with antidepressants. And my argument to them is, well, how can that be, if you're adding that to, how can that be just regular depression? It's not. The answer is it's not. Some people like the fact that they don't talk about bipolar, but there's variants I call bipolar spectrum. There's low-grade variants of bipolar that really are not talked about much. And that's really what Rexulti is treating, is what I call bipolar spectrum. And it really comes out as sometimes anxiety and often depression, and a combination of both. So Rexulti is a great medication. It also works on dopamine, but it actually works differently by slowing it down. But as you heard her say, with just the Pristiq and just the Rexulti now, she's not on Wellbutrin, she's not on Auvelity anymore, and she feels good. So my prediction is it's not going to last. I don't think it's going to last because eventually in the next month or two, probably she's going to kind of have that kind of come down again. Because now and then we're going to have to talk her into restarting the Auvelity, set the alarm. It's not that big a deal, just do it. And you heard her say, I don't like to be reminded with an alarm. Well, it's like, sometimes it's just, you just have to suck it up and do it if it's what's best for you. If it's just one simple thing like that, then. But again, this is what talking with patients is. Is a lot of that with people, just explaining, and that's why I always explain things to every patient about what I'm trying to do. Here's what I'm thinking. And that way I can, when I explain to people, they like that because most doctors don't do that. They don't explain. They just say, "Here, take a pill," and they don't understand. Well, what is it? I don't know. Just take it. So anyway, but in her case, again, things have turned out really well. She's feeling great. She's not having any suicidal thinking anymore. Even though it was passive, it's still not good. And she's doing great. And again, that's the only simple thing, like I said, is just I might add one thing, I might not. If a month, 2 months, 3 months, 6 months pass and she's fine, well, maybe we're out of the woods. It's possible that the Rexulti is all we need with the Pristiq. Maybe we don't need the other ones. Possible. That's the whole thing about this field of medicine, and this is why I love it. It's kind of figuring out a puzzle. It's not always as exact as here's your blood pressure medication for you're lowering your systolic blood pressure down to 120. Now you see numbers and you see blood tests with thyroid. Here, let's replace your thyroid, and then we can tell with the blood that your thyroid's well. That's fine, but it's boring in my view. It's and I used to do primary care for about the first decade of my practice. And I don't want to say boring, not disrespectful. I'm just saying it was very cut and dry. Here's what you do with this. And so it was a lot based on lab results and whatever. And I kind of lost interest in it after about a decade because I really started to learn that this was so much more exciting. It's so much more impacting on people's lives. I was seeing and it really had to do with, if you read my last book about the figuring out with Effexor came out in 1993, the first SNRI, the first one that did 2 instead of 1, and that's what I knew something big was happening, and that's what led eventually to me doing this full time for the last 25 years, writing. These are 4 of my books. I have 2 more coming out next month. My last ones, I promise, I'm not writing anymore. But that's what led me into this and my passion about teaching, because it's so impacting. As you see, like someone like her who was so miserable for years, and now she's doing so much better. Even being unemployed and having the stress of finances, she's still. So that's the result we want. And every person I see, I push for that. And if they're not there, I keep trying. Hopefully they let me, because some people don't. Some people say, nope, that's all I want to do. But hopefully this explains like why it's so important to get this right. So, but yeah, very good result with her. I'm very happy how she's doing.